This show is for educational and informational purposes only. It is not to be used for diagnosis, evaluation, prevention, or treatment, which requires your medical team. The purpose of this show is to help you become callus-free. It is said that the three most important things for a person with diabetes is education, education, and education. But I say it is prevention, prevention, prevention. And to prevent problems in the foot, you want to remain callus-free. The footpath to an amputation may be through a callus that became an ulcer. Stay off of this footpath. What is a callus? What is a corn? Thick skin that forms on the bottom of the foot we usually call a callus. Calluses usually form on the ball of the foot, the heel area, and the tips of the toes. The ball of the foot is where the long bones of the foot bear the most weight, then this pressure and friction can cause a callus. When the long bones push into the ground, sometimes hammer toes or claw toes are also formed with thickened skin at the tip of the toes. The calloused area can be very localized and have a core, or the callus can be widespread over a larger area. The callus may or may not be painful. People with diabetes should not try home remedies. Consult your medical team to help you become callus-free. The most common place for an ulcer in the numb foot is on the bottom of the foot behind the big toe. Sometimes an ulcer is hiding under the callus tissue. People sometimes mistakenly think the doctor who trimmed the callus has caused an ulcer, but it was already there hiding under the callus. Bleeding into a callus or black spots in the callus are signs of a pre-ulcer. A pre-ulcer is an ulcer but for a few more steps. A pre-ulcer should be taken as seriously as an ulcer. Get off your feet and call your doctor right away. The red circle shows where the callus most likely will become an ulcer for a diabetic foot. Not all thickened skin are corns or calluses. Proper diagnosis is important. Often corns are associated with a hammer toe or bone spur. Hammer toes rub on the top of the shoe. The shoe is unforgiving and it forms a pressure point, thus a corn. Thickened skin can also occur between the toes, and they can be also soft corns because it is moist between the toes and the tissue stays soft at times and they can be quite painful. Soft corns usually occur between the fourth toe and the fifth little toe. Diabetes can cause foot deformities and walking abnormalities that are compounded by aging, resulting in callus, corns, and skin changes that may lead to ulcers. Friction and pressures cause callus. Shoes that are improper are one of the leading causes of foot ulcers in people with diabetes. Foot deformity, biomechanics, and dry skin all can cause calluses. The disease of diabetes has many complications. One of the complications of diabetes is peripheral sensory neuropathy. Most diabetics have neuropathy. Peripheral means outside the center of the body, which are the legs and feet and the hands and arms. Peripheral sensory neuropathy starts in the toes and works up the leg, causing a loss of feeling. You can lose the gift of pain. Pain is a warning signal in the feet that helps you prevent injury. So in this slide, we see a progression from diabetes through sensory neuropathy to a loss of protective sensation. Protective sensation means the amount of feeling you need to protect yourself. And then injury and everyday pressures and rubbing forces can form a callus that can lead to an ulcer. At each stage, we can intervene to stop the progression. Once the diagnosis of diabetes has been made, Diet and exercise sometimes can put the diabetes back into remission. Once neuropathy starts, you can limit the damage by controlling your blood sugars and having your A1C at a level that you and your doctor wants. When you lose protective sensation to the foot and leg, you need to educate yourself. Injury and everyday pressures and rubbing forces mean it is time to moisturize. When callus forms, your medical team may have you use orthotics and shoes to manage the callus. Surgery may be used to control the callus. Self-care can be used to reduce the callus, or professional trimming may be utilized. When an ulcer is formed, you will need wound care and to offload the sore. Offloading means to take the pressure off the sore. As you progress through the stages that cause an ulcer, your blood flow may become worse, and you will need to learn how to keep the blood flowing. Once you have healed the ulcer, you will need proof that your diabetic shoes and orthotics are taking the pressures off the foot. You will note in this slide I have placed the recommended treatments before each stage of progression to prevent the next step, because an ounce of prevention is worth a pound of cure. PAD, PAD, stands for peripheral artery disease. This is the circulation problem that slows or stops the blood circulation to your feet and legs. The disease of diabetes has many complications. One of the complications of diabetes is motor neuropathy. Most diabetics have neuropathy, so in this slide we see a progression from diabetes through motor neuropathy to a loss of muscle strength. The small muscles of the foot lose their strength, causing hammer toes, and then injury and everyday pressures and rubbing forces can form a callus that can lead to an ulcer. At each stage we can intervene to stop the progression. Once the diagnosis of diabetes has been made, diet and exercise sometimes can put the diabetes back into remission. Once neuropathy starts, you can limit the damage by controlling your blood sugars and having your A1C at a level that you and your doctor wants. When you lose muscle strength to the foot and leg, you need to educate yourself. Injury and everyday pressures and rubbing forces means it is time to moisturize and monitor. When callus forms, your medical team may have you use orthotics and shoes to manage the callus. Surgery may be used to control the callus, or self-care can be used to reduce the callus, or professional trimming may be used. When an ulcer is formed, you will need wound care and to offload the sore. Offloading means to take the pressure off the sore. As you progress through the stages that cause an ulcer, your blood flow may become worse, and you will need to learn how to keep the blood flowing. Once you have healed the ulcer, you will need proof that your diabetic shoes and orthotics are taking the pressure off the foot. You will note in this slide I have placed the recommended treatments before each stage of progression to prevent the next step, because an ounce of prevention is worth a pound of cure. PAD, PAD, stands for peripheral artery disease. This is the circulation problem that slows or stops the blood circulation to your feet and legs. Diabetes is a disease of complications. Diabetes is a progressive disease. As diabetes progresses, the complications become worse. So in this slide, we see a progression from diabetes through autonomic neuropathy to a loss of sweating, which causes dry skin, and then a callus forms from pressure and friction forces that can lead to an ulcer. At each stage, we can intervene to stop the progression. Once the diagnosis of diabetes has been made, diet and exercise sometimes can put the diabetes back into remission. Once neuropathy starts, you can limit the damage by controlling your blood sugars and having your A1C at a level that you and your doctor wants. When you lose sweating to the foot and leg, you need to advise your medical team and educate yourself. When dry skin becomes apparent, it is time to moisturize. When callus forms, your medical team may have you use orthotics and shoes to manage the callus. Surgery may be used to control the callus, or self-care can be used to reduce the callus, or professional trimming may be used. When an ulcer is formed, you will need wound care and to offload the sore. Offloading means to take your weight off the sore. As you progress through the stages that cause an ulcer, your blood flow may become worse, and you will need to learn how to keep the blood flowing. Once you have healed the ulcer, you will need proof that your diabetic shoes and orthotics are taking the pressure off the foot. You will note in this slide I have placed the recommended treatments before each stage of progression to prevent the next step, because an ounce of prevention is worth a pound of cure. PAD, PAD, stands for peripheral artery disease. This is the circulation problem that slows or stops the blood circulation to your feet and legs. Once you have had a diabetic foot ulcer healed, you will want to use an in-shoe pressure measurement system that will allow you to see if your shoes and orthotics are taking the pressure off. This proof is necessary to make sure that you do not re-ulcerate. Gently rub calluses with a pumice stone. You can smooth corns and calluses gently. Thick patches of skin, called corns or calluses, can grow on the feet. If you have corns or calluses, check with your foot doctor about the best way to care for them. If your doctor tells you to, use a pumice stone to smooth corns and calluses after bathing or showering. A pumice stone is a type of rock used to smooth the skin. Rub gently, only in one direction, to avoid tearing the skin. Do not cut corns or calluses. Do not use razor blades, corn plasters, or liquid corn or callus removers. They can damage your skin and cause an infection. By removing the callus, we reduce the pressure on the foot by 29%. An important treatment of callus is by orthotics and diabetic shoes. Calluses can be quite stubborn, but good orthotics and diabetic shoes should be able to relieve the pressures, the time the pressures act on the foot, and the rubbing forces that cause a callus. Good orthotics are not easy to make, and the callus may not disappear right away. Work with your medical team to be callus-free. A foot orthosis is known as an orthotic. Orthosis means to brace. An orthotic is a medical insert for your shoe that is a brace for your foot. An orthotic looks like an arch support, but it is designed to alter the forces acting on the bottom of the foot in order to allow more normal foot and leg function. It can also alter forces acting on the bottom of the foot during weight-bearing activities. An orthotic can heal injuries and make them non-painful. Orthotics can also prevent future problems, such as a callus or an ulcer, by reducing abnormal forces. Orthotics might look different depending on what they are trying to do. Accommodative and functional orthotics are made from different materials. They will probably look and feel different to each other. Orthotics are generally recommended as a pair, just like you wear a pair of shoes. Accommodative, functional, and combination orthotics can be custom, customized, or preformed. Preformed orthotics are also known as prefabricated, or prefabs, which are also known as off-the-shelf or over-the-counter or retail orthotics. Custom orthotics are usually fabricated from a cast or scan of the foot. Customized orthotics are preformed orthotics that have additions or changes made to it to address a particular foot condition. Preformed orthotics are fabricated to a predetermined size. Each of these types of orthotics can be pathology-specific orthosis, which means they treat a certain problem. An accommodative orthotic mainly relieves pressure, shock, and/or shear forces by padding or cushioning the pressures and shears on the bottom of the foot. Accommodative orthotics tend to be soft orthotics. One type of accommodative orthotic is the total contact orthoses, known as a TCO. This type of orthotic touches all of the bottom of the foot. The type of orthotic most commonly prescribed for a person with diabetes is a TCO. If you have callus, this may redistribute pressure away from this area of increased pressure. A functional orthotic mainly controls alignment and motion. Functional orthotics tend to be hard. Abnormal motions of the foot can cause pain. Functional orthotics decrease the abnormal forces. In this picture, we see a left foot that is out of alignment. With the orthotic, we see it is bracing the foot and is realigning the foot and ankle. Combination orthotics attempt to combine the needs of an accommodative and a functional orthotic. A type of combination orthotic would require rigid materials under the heel and arch only and a forefoot extension using soft materials. Shear band is used to reduce friction, therefore eliminating shear forces in a particular spot. The PTF patch, like shear band, has a sticky backing that can be stuck to an orthotic. Diabetic shoes are your super sugar shoes. They are of supreme importance to the person with diabetes. About 2% of people with diabetes get an ulcer each year. If you get an ulcer, your doctor may not have you leave the office wearing the shoes that caused the ulcer, and that includes diabetic shoes. A healing shoe or boot may be necessary. In the early stages of diabetes, wearing proper shoes may include shoes with proper styles and fit. Athletic shoes can be good shoes in the early stages of diabetes. Pressure systems are part of the medical team's care of the diabetic foot. The amount of force and the area over which it is applied and how long that force is applied are all important. Orthotics attempt to change the pressure to spread it over to a larger area or move it to a different area. Also, orthotics and diabetic shoes reduce rubbing forces. After a sore has healed, a pressure reading is required to prove the orthotics and diabetic shoes are relieving pressures. Diabetic shoes and pressure-reducing inserts protect feet for people with diabetes. Protection is good prevention. Protecting feet may mean being callus-free. Footwear can reduce pressures. Notice how the front and back of the shoe are taking pressures off. Note in the front of the shoe, the placement of the rocker is vital because it could add weight to the callus under the outside of the foot. Shoes, socks, and orthotics work together to prevent callus and to remove callus. Padding in shoes for people with diabetes must be done with great care. They must be placed in the correct position. Also, pads can move around in the shoe, so they may cause problems. Note, padding should only be recommended by an experienced medical team member. Knee pads are my personal favorite pads. They are an effective padding for the shoe or orthotic. Hay pads are wool felt padding. Here we see various types and styles of padding that may or may not be used to help your foot stay callus-free. Moisturizing can help with callus formation, both preventing and reducing calluses. Some moisturizers are medications. Get help from your medical team on choosing the right moisturizer for your disease stage. Exfoliants remove dead skin from the foot. Lactic acid and urea are two ingredients that remove dead skin. Use these medications only with your doctor's recommendation. Surgery also can prevent problems for the diabetic. Correcting bunions and hammer toes may be good preventive medicine. Speak with a foot surgeon to see if correcting your foot deformities would benefit you. Some self-care practices are just not beneficial for a diabetic. The problem is you might get away with it for a while, but down the road it could lead to a disaster. Let's look at some self-care practices that you shouldn't do. Don't use corn pads, especially if they are medicated. Medicated pads can be dangerous because they contain acids which can burn a hole in your foot. Don't be a bathroom surgeon. Do not cut or trim corns or calluses. It is just too dangerous and could lead to an ulcer. Calluses should be trimmed carefully and cautiously by a professional. And remember, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Joe.